Okay, so now we're actually going to do a demonstration about how to do an insulin injection, and I'll show you how to prep some of the pens out there. So we're going to start off with just looking at, as an example, Lantus pen. This is one of the long-acting basal insulins. This pen comes pre-filled, so you literally take it out of the fridge and it's ready to go. When you go to do an injection, you're going to need a needle, and so you're just going to peel this off, and then you're going to take your pen and just simply twist the needle onto the top of it. And here, just so you're not afraid, I'll show you how big the insulin needles actually are. That's 5 millimeters. It's teeny tiny. It's like getting bit by a mosquito. So first, whenever you go to do your first injection, you want to make sure that there's no air at the top of this needle. So you need to what's called prime the pen. In order to do that, this is a window that shows you how many units of insulin you're going to give. So you just crank the dial and crank it to 3 or 4 units and just press the plunger and make sure that insulin is coming out. And now you know that the next time you turn the dial, you're actually going to get insulin delivery into your body. So let's say your prescriber tells you to take 10 units of insulin at bedtime. Once you prime the pen, you're going to just click 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay? And so now you know you're on the right dose. And so when you go to give an insulin injection, the places that you can actually give an insulin injection are as follows. You can use your tummy. You're going to want to avoid right around your belly button, but anywhere here on the side or here on the side is fine. You can use this part of your body, so the flank on either side. You can use this part of your arm, the tricep area, on both sides. And you can also use the side of the leg, okay? So lots of real estate to use. Most people will use the tummy because it's the easiest and the most convenient. So when you're ready, you will take the skin. You don't need to pinch, and you just go straight in at a 90-degree angle, and you're going to push down on this plunger till it's all the way down, and then you count to 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And then you can come right out and you're done. Okay? You then want to take off this needle and dispose of it in a sharps container. Don't throw it in the garbage so that people don't get poked by this. And then you can put this back in your medicine cabinet. The next time you go to use it, you're going to need a new insulin tip. Okay? The same principles apply to the fast-acting insulins. So for example, this is a Humalog quick pen. So this is one of the rapid-acting insulins that's usually taken before meals. And you set it up the exact same way. The only one of these pens that's a little bit special is NPH insulin. Okay, so unlike the other insulins, which were clear, you can see that this one is cloudy. And so before you do an injection with this cloudy insulin, you need to make sure that it's nice and mixed. And so the way to mix this up is you want to go up and down 20 times. And this ensures that this is nice and mixed and cloudy. You should not be able to see through it. You don't want to do this because then air bubbles will form in there. So just be patient, and then just like with the other insulins, you're ready to go. Okay. Okay. And you're done. Okay, so I hope that you found that video helpful and that insulin injections are not as intimidating as you may have thought.